We're in East Harlem, where this continues to be a delicate dance in addressing this passionate debate about how to protect someone's rights when they're experiencing a severe mental health crisis, and of course protecting the public safety.
I'm petrified. I'm sick of it.
Lisa, a native New Yorker from the Bronx, offering her opinion on the state of affairs in the subway system, specifically her train stop on East 125th Street in East Harlem, where earlier this week, a 45-year-old man was fatally pushed onto the tracks. The suspect, a 24-year-old man who relatives say has at least 2 mental health hospitalizations. Lisa and other riders we met Friday fed up with what they say is a revolving door of psychiatric care. What do you worry about when you're standing on the platform?
I worry about being pushed. They should be in a mental institution.
You can't be just have them on the street, and then after something happened, then they talk about it.
The challenge? Figuring out the most effective way to engage with someone in mental health crisis, how long they should remain in treatment, and whether that should be done against their will.
We're going to respect civil liberties, but you don't respect individuals when you ignore that they're crying out for help.
On Thursday, Mayor Eric Adams touted the latest efforts to prevent another tragedy, including $20 million in Governor Kathy Hochul's proposed budget to expand from 2 to 10 the number of Scout or mental health co-response teams. Scout teams have the authority to hospitalize someone in crisis against their will. Governor Hochul is also proposing the addition of 200 new inpatient psychiatric beds in state-owned facilities. Don O'Shaughnessy, a National Alliance on Mental Illness national board member, says there are gaping holes in the mental health safety net.
When somebody is out of the hospital, the discharge plan must have the proper follow-up care. And that is missing, in my opinion.
New York Civil Liberties Union senior staff attorney Beth Haroules says government should proceed with a measured approach to care.
Some people might need longer-term institutional placement and treatment, but most people don't need that. No one gets any of it.
Mayor Adams continuing to insist that overall this is indeed a safe subway system and defending the number of Scout teams that would be on duty, saying that they don't need to be everywhere all the time, but will certainly respond to a report of someone experiencing a severe mental health crisis in the subway system.